Good morning friends, myself Dr. Shrinidhi Kumar Acharya from NIA Jaipur. Today I will explain the treatment principles of Ayurveda in the management of nephrotic syndrome. Next one. Now in the beginning, some of the basics regarding nephrotic syndrome. Okay. So what do you actually mean by nephrotic syndrome? This is a condition which contains three main symptoms. One is massive proteinuria will be there, especially albumin, hypoalbuminemia will be there, and albumin is 2.5 grams per deciliter in the blood, and there will be edema, massive edema will be there, then hyperlipidemia will be there, that is serum cholesterol will be about 200 milligram per deciliter. When there is combination of these three symptoms, then usually it manifests nephrotic syndrome. Further, this nephrotic syndrome may be caused by different disorders. It may either due to the disease of the glomerulus sometime, that is either limited to the kidney itself, and this condition is called as primary nephrotic syndrome. Okay, this is called as primary nephrotic syndrome where the disease is limited to the kidney and glomerulus. And sometimes nephrotic syndrome may be also caused by some other condition other than kidney. So it may affect the kidney due to some other factors, then that is called as secondary nephrotic syndrome. So like this, nephrotic syndrome is basically divided into primary and as well as secondary. Next one. Now let us discuss about primary nephrotic syndrome. Okay. So primary nephrotic syndrome is further divided on the histological basis. Okay. So one of the main classification of primary nephrotic syndrome is minimal change nephrotic syndrome or minimal change nephrotic disease. As far as children are concerned, this is of main focus because 90% of the cases of nephrotic syndrome in children are because of this minimal change nephrotic disease. Okay, this is most common in children, and the specialty of this is when you see on the optical microscope there is no any much change in the histological appearance, or there is very minimum appearance. Therefore, this disease is also called as minimal change nephrotic syndrome. Okay. Now, but there will be massive proteinuria anyhow. So this is most common in children, and we are planning Ayurvedic treatment basically on this particular problem. Okay. So one more type of primary nephrotic syndrome is focal glomerulosegmental sclerosis. One more is membranous glomerulonephritis. Another one is membranous proliferative glomerulonephritis, and one more is rapidly progressive glomerulonephritis. Out of all these things, most important, on 95% of the cases we are getting minimal change nephrotic syndrome. This is also called as idiopathic nephrotic syndrome. Next. Anyway, a short information about the secondary nephrotic syndrome also. This is caused because of the facts or factors which are away from the kidney, not from the kidney, other than the kidney. Some of the factors are responsible for nephrotic syndrome, and they are considered under secondary nephrotic syndrome. Okay. The causes are diabetic neuropathy, systemic lupus erythematosus, sarcoidosis, syphilis, hepatitis B viral infection, HIV, amyloidosis. In amyloidosis also there is a deposition of the segments in the glomerulus. Then vasculitis, some of the cancers, and one of the rare variety is congenital nephrotic syndrome. Congenital nephrotic syndrome is a rare variety. It is also called as Finnish nephrotic syndrome. And some of the drugs may also cause nephrotic syndrome, especially gold salt and penicillin, captopril, etc. Next. What are the incidences? Now this is very important. What are the incidences? See, 90% of the children will have idiopathic type of nephrotic syndrome. Idiopathic means there is no exact causes till today known, and this is also called as minimal change nephrotic syndrome. Okay, 85% will have minimum change nephrotic syndrome, and about 5% will have mesangial proliferation, and focal sclerosis about 10%. Okay, so it is quite clear that 90% of the cases of the nephrotic syndrome which is occurring in case of children or afflicting the children are belongs to this particular idiopathic type or minimal change nephrotic syndrome. Next. A short pathophysiology of the disease. Now we know that in the kidney, why all these things occur? Because we have got three main symptoms. One is edema, another one is protein loss, another one is increased cholesterol. These are the three important symptoms which are seen in case of nephrotic syndrome. Let us see the pathology in short. In the kidney there is a glomerulus which filters the blood which arrives to the nephrons, and the glomerulus contains a basement membrane which is called as glomerular basement membrane, and there is a filtration slits between the podocytes which performs the filtration function. Okay. There is also the presence of mesangial cells and matrix and CD206 cells. Okay. Cluster will be, receptor cluster will be there. In total, all these three things will perform the filtration process. Next one. Now, proteinuria which result from increase in the glomerular capillary wall permeability. This is the main factor here. There is increase in the glomerular cell wall, basement membrane permeability, because of which certain proteins which are essential to the body, which has to be withheld, so they are passing through the urine. Okay, this is because of the increased permeability of the glomerulus. So, exact mechanism why glomerular permeability increases is still unknown. It is till today it is not known exact mechanism, and loss of some negatively charged glycoproteins within the capillary wall is considered as the most common cause, predicted cause. Okay. Now, there will be loss of proteins through the urine, and that result to hypoalbuminemia in the blood, and when the albumin is lost, the pathology starts now. Okay. So, in nephrotic state, the protein excretion exceeds 2 gram in 24 hours. Mainly the albumin is lost, therefore hypoalbuminemia will be seen. Edema appears when serum albumin falls below 2.5 gram per deciliter. Next. In nephrotic syndrome, glomerulus is afflicted by inflammation or hyalinization. These are the two predicted causes. Either the permeability of the glomerulus will going to increase, either because of the inflammation of the glomerulus or hyalinization that allows the proteins such as albumin and antithrombin or immunoglobulins to pass through the cell membrane and get appears in the urine. So, this is most predicted cause till today. Cause of inflammation and hyalinization is again unknown, till it is not known, and therefore usually it is called as idiopathic nephrotic syndrome or minimal change nephrotic syndrome, which is very common in children, and today we will going to discuss about this factor, that is idiopathic nephrotic syndrome or minimal change nephrotic syndrome and Ayurvedic approach. Okay, the most suspected cause by considering all idiopathic factors and other factors, the different thoughts regarding nephrotic syndrome, it says that the most suspected cause is something related to body immunity. Next one. These are the two pathologies which are explained as far as edema is concerned. Edema is one of the major symptoms. Initially there is a localized edema, this will be followed by generalized edema. Therefore, what are the two pathologies of this edema? So, one is underfill hypothesis, another one is overfill hypothesis. It is very simple. To be short, there is loss of albumin. Loss of albumin leads to loss of plasma oncotic pressure. When there is change in the plasma oncotic pressure, there will be leaking of the fluid from the vascular space into the extravascular space, and this develops into edema. In the meantime, there is also some other stimulation of angiotensin, aldosterone system, which releases ADH, and there is increased salt and water retention by the kidney, which further increases the edema. These are the different views. Next one. This is what already we have discussed, that is the pathophysiology of the edema because of hypoalbuminemia. Next one. Now, what exactly happens in case of nephrotic state? All the serum, lipids, cholesterol, triglycerides and lipoprotein levels are raised. Okay. Hypoproteinemia stimulate the generalized protein synthesis in the liver, including the lipoproteins, and lipid catabolism is reduced owing to the reduced plasma levels of lipoprotein, lipase, which is a major enzyme system that removes the lipids from the plasma. So, this is the reason or pathology behind why there is increased level of fat or lipoproteins or cholesterol in the conditions of during the condition of nephrotic syndrome. Okay. So, likewise we have seen the pathology of the edema in short, pathology of the glomerular damage in short, and pathology of development of this particular cholesteremia in short. Next. Now, these are the basic difference when we see between the minimal change in nephrotic syndrome and secondary nephrotic syndrome. Okay, secondary nephrotic syndrome is different from the minimal nephrotic syndrome, and minimal nephrotic syndrome is quite common in 2 to 8 years, whereas secondary is quite common in the older children, whereas sex it is more in boys, and minimal nephrotic syndrome is rarely presented with hematuria. There is no hematuria, and blood pressure is also normal. Sometimes transient hypertension may be seen, or glomerular filtration rate is normal. Then renal biopsy, there is no need of renal biopsy because most of the time it shows minimal change in the histological appearance. Then proteinuria will be there, high tendency to proteinuria will be there, and very important is the response to steroids. So, steroids will give a very good result, and remission is about 95%. So, this makes the point. When you give the steroids, there is a sudden recovery of the symptoms. So that again suggests towards some immunological aspects as steroids are immunosuppressive, that we will discuss in the later part. Okay, prognosis is quite good, and relapses are stopped by second decade. At the end of the second decade, most of the time the relapses will going to disappear, and serum C3 complement C3 levels are also looks to be normal. Okay, this is the factors regarding minimal change in nephrotic syndrome, which we will going to discuss in future. Next. Yes, this is idiopathic nephrotic syndrome or minimal change in nephrotic syndrome. So, as I told earlier, most of the time the cause is considered as idiopathic and no particular cause has been till now identified, and therefore it is called as idiopathic. And immune suppression leads to rapid result. This is the point to be considered. In case of idiopathic nephrotic syndrome, once you go for immunosuppression, the results will be there. Rapid recovery from the symptoms is there. So, what it suggests? Of course, immune suppressive drugs will also have some other effects. Suppose if I am giving a steroid as an immunosuppressive, it is basically an immunosuppressive, but in the meantime it is also having some other effect like anti-inflammatory effects. So, some schools of medicine, so they believe that it is not only the immune suppression which is working here in case of steroids, but some other functions of the steroid may be also contribute to the rapid recovery of the patient. But anyhow, the most expected one is immunosuppression. Glomeruli appears normal or minimal, increase in the mesenchymal cell and matrix will be seen. Next one. Okay, so hence from the previous slide it is quite clear that idiopathic nephrotic syndrome or minimal change in nephrotic syndrome, the most common suspected cause is immunological cause. There is an exaggerated immune reaction which is the basic cause for all these problems. Now let us see some of the symptoms. Okay, so again as I told earlier, this is very common in boys rather than girls. 2:1 ratio is there, most common between 2 to 6 years and up to 10 years. The first symptom is always edema. Yes, presentation of the patient in the beginning is always edema. Patient comes to you with the complaints of swelling around the ears and the lower extremities, and that swelling is typically epitic type, and in the due course of the time edema becomes more and more generalized, and there will be weight gain. There will be, in the next due course of the time, again there is development of pleural effusion, pericardial effusion, edema fluid go on collecting in every loose part of the body, scrotal edema, ascites will be seen. Then there is development of the edema in the other parts of the body. Sometimes the edema shift to the back, sometimes edema shift to the face like this. Then associated, this will be associated with the loss of appetite, abdominal pain, diarrhea may also occur. Hypertension is transient type of hypertension will be seen. Next one. How to diagnose the nephrotic syndrome? The urine analysis, that is urine analysis for albumin, especially protein and albumin, 3 plus or 4 plus, so that is quite diagnostic. And microscopic hematuria is rare, it is not seen. A renal function test may be normal because it is a minimal change in nephrotic syndrome, or sometime it may be reduced. Now what is important is protein. You have to collect 24-hour urine specimen and send it for investigation. If 24-hour urine specimen shows that the total amount of the albumin which is lost through the urine is more than 2 grams, 2 to 3 grams, so then it is indicative of clear-cut manifestation of a nephrotic syndrome. Okay, so total serum calcium levels are also decreased in due course of time. Next one. How to diagnose again? The children with the onset of nephrotic syndrome between the age of 1 to 8 years likely to have the steroid dependent nephrotic syndrome. So when, especially we Ayurvedic people, when we receive the patients, so usually we will receive the patient in this particular condition. Patient is taking lot of steroids and he is steroid dependent, and then he is coming to Ayurveda. Okay, so corticosteroid given with the corticosteroid can be given without doing any biopsy, okay, because this is the initial treatment. Children older than 8 years, the membranous and proliferative type of nephrotic syndrome is becoming common. So renal biopsy is required. So very clear, when renal biopsy is required, if the children are not responding for corticosteroid therapy, then renal biopsy is required. If they are responding, there is no any exact cause for renal biopsy. Next one. Okay. There are some complications of nephrotic syndrome. We will see it in short because we have to shift for Ayurvedic treatment now. The infections are the most common causes because bacterial infections are during the relapse is quite common because we are giving steroid. Steroid is basically an immunosuppressive drug. So because of immunosuppressive nature, the infections become more and more common. This is very common thing. And decreased immunoglobulins will be seen. Edema fluid which is collected in the body, that also give a culture medium for the growth of bacteria, so chance of infection further increase. There will be protein deficiency. Proteins are very much required for the formation of the antibodies and all. Therefore, again this increases the chance of infection. So, decreased bactericidal activity of the leukocyte will be seen. Again, this interferes with the immunological activity and chance of infection will be increased. And steroids, as we know, it itself is a immunosuppressive. Then decreased perfusion to the spleen is there because of a hypovolemia. Then there will be loss of certain complement factors in the urine which opsonizes certain bacteria. So, spontaneous peritonitis. So, this is the most common thing. Spontaneous peritonitis is the most common infection. UTI, then sepsis, pneumonia, upper respiratory tract infection, cellulitis are also very common. See, when we are dealing Ayurvedic aspects, so these points are very important because we receive the patient with the steroids. So, when patient is taking the steroids and this is becoming more and more chronic, so what we have to think about the recurrent infections. These are the common recurrent infections we have to keep in mind, that is UTI, peritoneal infection, then sepsis, pneumonia, upper respiratory infection. So, that has to be tackled very well. Now, a patient of upper respiratory tract nephrotic, a patient of nephrotic syndrome, so usually have recurrent upper respiratory tract infection, and he also gives the history of recurrent throat infection, that we will discuss further next. Other complications, the tendency of arterial and venous thrombosis is there due to rise in the certain coagulation factors. Then deficiency of the clotting factor will be also seen. Vitamin deficiency is also there. Recurrence will be very common. Peritonitis is very common. Renal functions disturbance is also seen, and consequence of protein and albumin loss. There are so many problems because of protein and albumin loss. Next, how to diagnose? Okay, how to diagnose? So, we have to think about 3 or 4 important terms here. One is remission. Nephrotic syndrome is a disease which is known for relapse and recurrence. Okay, there will be so many recurrences, at least 3 to 4 times recurrence will be there per year in a typical case of nephrotic syndrome. With every recurrence, the disease becomes more and more chronic and the steroid dependence will be more and more. Okay, so this being the case, what do you mean by remission? A protein free urine, that is urine protein is negative or trace or 4 milligrams per hour for at least 3 consecutive days, then it is called as remission. Okay, that means patient is remitted from the disease. Next, what is relapse? If the urinary protein is 3 plus by dipstick method for at least 3 consecutive days, then we will call it as nephrotic syndrome is get relapsed. Okay. Then what do you mean by frequent relapse? 2 or more relapses within 6 months of initial response, or for any more relapses in any 1 to 2 month period, then it is called as frequent relapse. Okay. The one more term is steroid resistance. Failure to achieve the remission after 8 weeks of steroid therapy is called as steroid resistance. Whereas, what do you mean by steroid dependence? Development of relapse within 2 weeks of stopping or while tapering the steroid therapy, then it is at least in 2 occasions, then it is called as steroid dependence. These are the 4 terms which we have to understand. Most of the time, we receive the patient either in the stage of a frequent relapse, steroid resistance or steroid dependence. Next one. So, this is the approach of the treatment in the contemporary medical science. We can discuss it later. Next one. Yes, these are the treatment schedule. First episode may be hospitalized or outpatient ward, it can be treated for the diagnostic and therapeutic and as well as educational purposes. Sodium intake is restricted by no added salt in the diet. Fluid intake is restricted until and unless edema is very severe. Affected child may attend to the school and involved in tolerable physical activities in the beginning phase. Next one. Diuretics to begin with the chlorothiazide and later spironolactons to avoid the potassium loss can be given. When edema is severe with respiratory distress, there is a need of hospitalization. Then sodium restriction is continued and scrotal care should be given. These are some of the treatment models in the contemporary medical science which is going on. Next one. Now, basically this is very important. We have to discuss little bit about the steroid therapy because this is of matter for us when we are dealing in Ayurveda. So, after the diagnosis, steroid therapy should be given after consulting with the family because steroid has got so many adverse effects. So, 60 milligrams meter square 24 hours, this is the dose. Maximum daily dose should be 60 milligram divided in 3 to 4 doses. Okay, time needed is 2 weeks for getting the response till the urine becomes free protein, and this is how the different schedules of steroid treatment. Next one. This is very important, steroid complications. Corticosteroid toxicity is there, Cushingoid appearance, hypertension, growth failure, premature closure of ossification center, immune suppression, repeated infections, then disturbed fat metabolism and hypercholesteremia. These are the common complications of steroid therapy. So when patient comes to Ayurveda, we have to tackle this problem also. Patient is not only coming to Ayurveda with nephrotic syndrome, he is also coming with the complications of steroid toxicity. So we have to deal both the things. Next one. Other options after steroid toxicity, once the patient get resistance to steroid, what are the other options available in the contemporary medical science? So they will go for some other immunocompromising or immunosuppressive drug. Either they will go for cyclophosphamide therapy or methotrexate or anti-cancer drug, 𝑉𝐸𝑚, and the last option, kidney transplantation. So these are the other options which are available in the contemporary medical science. Next. Prognosis, usually the prognosis is good in spite of repeated relapses until the disease relapses spontaneously. Towards the end of the second decade, the prognosis is becoming better and better, and by the second decade onwards, usually patient will not have much recurrences here. Okay, and of course, a psychological effect which is caused because of this recurrent infection is also very obvious. It has to be also tackled. Next one. Yes, now we will come to the main part of our talk. So that is Ayurvedic understanding of this particular disease. See, certain fact has to be considered here. Number one, the high prevalence of this disease is in child with a recurrent throat infection. Okay, when you see minimal change in nephrotic syndrome or idiopathic nephrotic syndrome, we will get a strong history of recurrent respiratory tract infection or recurrent throat infection. History will be there. Okay, so we know that so far we have discussed that in case of minimal change in nephrotic syndrome, so far no exact cause has been identified, and some of the schools says that, some of the researchers also says that it is because of immunological cause. Most of the studies point towards immunological base. So an immune mediated response which is of exaggerated type is causing the damage to the glomerular membrane. So this is again evident by the fact that after giving steroid therapy, the symptoms rapidly recover. Patient will rapidly recover, symptoms will reduced. So why? So that suggests that when you give an immunosuppressive drug, it causes inhibition of exaggerated immune reaction, and as a result the recovery will be seen. Okay, so same, it is a type of what do you mean by autoimmune reaction which is happening. Our own immune cells are causing exaggerated immune reactions, and as a result there will be the problem. But there is no any specific immune globulin deposition was found in the glomerulus, but anyhow they believe that it is of immunological cause. So there is definite role of T mediated immunological response with the abnormal secretion of lymphocytes by the cells is thought to be modify the glomerular basement membrane. So B cells are also involved during the relapse. So all these facts point towards the fact that this disease is something to do with the body immunity. Therefore, it is exact cause of the disease is not till identified, and it is called as idiopathic or minimal change in nephrotic syndrome, and there is a definite involvement of body immunity because exaggerated immune reaction is causing the problem. When you go for the immunosuppression, the symptoms are get relieved. So this suggests that there is something to do with the body immunity. Next. So this is what I already described, that is immunity is a prime factor. All the explanations are suggestive of definite involvement of immune system in the pathogenesis of minimal nephrotic syndrome. Immunity in Ayurveda. So when we come to Ayurveda, immunity in Ayurveda is compared with the Ojas. For all practical purpose, we compare immunity in Ayurveda with the Ojas. Yannasho, Niyato, Nasho, Yasmin, Tishtati, Tishtati. So it is also compared with the Bala, that is Kapha. Immunity is also have a comparison with the Kapha because Kapha is the one which sustains the body. Okay, it is Stiratvam, Shleshmaha Stiratvam, it gives a stability to the body. Therefore, immunity in Ayurveda is compared with the two factors, either with the Ojas or either with the Kapha. So as immune suppression result in excellent recovery of the symptoms. In case of nephrotic syndrome, minimal change in nephrotic syndrome, immune suppression is leading to excellent recovery from the symptoms. An exaggerated immune response has been predicted. Okay, this is nothing but autoimmunity like factors. Okay, so this can be very well compared with the concept of aberration of Ojas. So abnormal immune activity or abnormal immune activity in Ayurveda can be very well compared with the concept of aberrations of Ojas. There is some problem related to Ojas, and in terms of Ayurveda, which is a basic cause for this particular disease. Next. So one thing is Ojas is involved, as it is clear from the previous slides. Then involvement of Kapha is also a vitiating factor. In the child, it is a Balyavastha. Balyavastha always Kapha is Shleshmaha Vivardhatehe Balaha. So body is made up of three vital forces. Kapha always take care of body, immune system, Shleshmaha Sthiratva Snigdhatvam. Okay, and especially Avalambaka Kapha, that plays an important role. Balyavastha is a stage where Kapha is dominant. Meantime, functionally Kapha is deficient or underdeveloped and on the process of development. So instability of Kapha leads to certain fluctuations in the immune system, and functions of Kapha and Apara Ojas are almost all similar. Hence, it has got direct influence over the Ojas also. So all these above factors suggest that there is also some relation of Kapha with the body immunity or Ojas. Okay. So this Kapha and Ojas both are get disturbed in case of nephrotic syndrome, and they are causing exaggerated immune reaction. Next. Now let us discuss the minimal change in nephrotic syndrome versus Oja Vyapath. Now Ojas aberration, when I say, it has got two facets. One is Oja Visramsa, another one is Oja Vyapath. Oja 𝐶𝐻 is a different issue. There is decreased functioning of the immune system. But here Oja Vyapath, Oja Visramsa and Oja Vyapath, both are there is aberration, that is exaggerated or abnormal form of immune response will be seen, which is a typical cause of a minimal change in nephrotic syndrome. So an exaggerated immune response causing damage to the own body cells, that is maybe glomerulus in this case, that is called as aberrations of the Ojas. Yannasho niyatho yasmin tishtati tishtati. If the Ojas is proper, then the body will be maintained. And see, these are the Oja Vyapath symptoms, which are also the symptoms of nephrotic syndrome. If you carefully observe, Stabdhata, that is restricted body movements, stiff and as firm, that is because of edema. Then Guru Gatrata, weight gain will be commonly seen in case of, because weight gain is one of the important indicator also to see the nephrotic, to assess the nephrotic syndrome. Weight gain is commonly seen. So Guru Gatrata, weight gain due to disturbed fat metabolism and collection of the fluid in the body. Then Vata Shofa, maybe generalized pitting edema throughout the body. These are all the symptoms of Oja Vyapath. Okay. Then Varna Veda, that is because of edema, glossy appearance, shiny appearance of the body and pale body. Then Glani, discomfort, loss of interest, loss of appetite, physiologically, physically and as well as psychologically. Okay. Lastly, Tandra and Nidra, so they are altered form of consciousness in the later stages. So all these symptoms are suggestive of Oja Vyapath, okay, which is typically seen in case of minimum nephrotic syndrome. Next. One more factor, again Ojas is anyway, it is involved. One more factor is Oja Visramsa. Oja Visramsa is also one of the cause of aberration of Ojas in this case. So we see Oja Visramsa, so especially there is Sandhi Vishlesha, that is instability of the Sandhi. Shleshaka Kapha may be deranged. Then Gatranam Sadhana, that is due to protein loss. There is Gatranam Sadhana because protein is a body builder, building element. So it is a Gatranam Sadhanam. Dosha Chavana, that is disturbance of equilibrium of the doshas will be seen. Then there is Kriya Sannirodha, that is exercise intolerance and dyspnea will be seen. So all these factors are seen in nephrotic syndrome, minimal nephrotic syndrome, which are also the symptoms of Oja Visramsa, and we already proved that there is involvement of the Ojas and Ojas aberrations in case of nephrotic syndrome, which is causing abnormal immune reaction. Next. Now come to the next part, Oja 𝐶𝐻. Okay, Oja 𝐶𝐻, it is not aberrations of the Ojas, it is suppression of the Ojas. Okay, it is because of suppression of the Ojas. So immune suppression due to steroids. Many times patient comes to us with this particular condition, patient taking lots of steroids and he is coming to Ayurveda. In that stage, we have to consider that disease as in the stage of Oja 𝐶𝐻, not as Oja Vyapath, because maximum complaints of the patient is because of steroids only. Okay, so steroid toxicity only. Therefore, we have to consider that condition as Oja 𝐶𝐻 along with Oja Vyapath, and we have to treat accordingly. That we will discuss. For all practical purpose, we compare Ojas with the immunity, and as it is also explained in case of Rajayakshma also, Ojasaha vardhito ashubhyam shuddham sattvam matapicha. Once the Ojas is increased, automatically the body also get improved in case of Rajayakshma. So Oja 𝐶𝐻, that is compared with the immunocompromised state, which is caused by excess exercise, low calorific diet, improper food habits, excess coitus, overwork, excess loss of kapha and rakta and mala from the body. These are the causes which are given in the science for Oja 𝐶𝐻. But in this case of nephrotic syndrome, Oja 𝐶𝐻 is because of immune suppression. Next one. 𝐲𝐽𝑒𝐽𝑒𝐜, that is immune suppression due to steroids. Okay. So we know that 𝘊𝘺𝑗𝑒𝐻 बिभेति अभीक्ष्णम, that is generalized body weakness and malaise will be seen, and there will be disturbed psychological state, there will be bad mental feelings, uncomfortable feelings, then murcha, mamsakshaya, moha, pralapa, and lastly marana. All these factors are seen because of 𝐲𝐽𝑒𝐽𝑒𝐜. So all these symptoms are also seen in a patient who is taking steroids. Okay, steroids which is an immunosuppressive. So what is the treatment when patient comes to you with this particular stage of nephrotic syndrome? Details will be seen further. We will see further. But in this stage, I would like to say, when a patient comes to with the 𝐲𝑽𝑒𝐽𝑒𝐜 to you, then Jeevani Aushadas, Kshira, Mamsarasa is the treatment, because we have to lift the patient from the 𝐲𝑽𝑒𝐽𝑒𝐜 condition. First, we have to maintain the normalcy of the 𝐲𝑽𝑒𝑠. That has to be done. Next. So by all the above explanation, one factor is very clear. What is that? There is involvement of the 𝐲𝑽𝑒𝑠. Either there is aberration of the 𝐲𝑽‌Es, either there is Kshaya of the 𝐲𝑽𝑒𝑠 in case of nephrotic syndrome. Kshaya of the 𝐲𝑽𝑒𝑠 is because of the treatment, and aberrations in the 𝐲𝑽𝑒𝑠 because of the pathology. Now the question comes, why this 𝐲𝑽𝑒𝑠 is get aberrated in case of nephrotic syndrome? Now all the above explanations of the contemporary explanations point towards the fact that there is involvement of immune factor or 𝐲𝑽𝑒𝑠 as the basic cause of this nephrotic syndrome. There is also the involvement of kapha, that is also clear from the previous slides. They use the immune suppression method to get relief from the nephrotic syndrome, that is also clear. Now also other immune compromising drugs are also given in the later phase of nephrotic syndrome, that is also clear. Now the basic question is, why there is aberration of the 𝐲𝑽𝑒𝑠? Why there is aberration of the 𝐲𝑽𝑒𝑠? This is the basic cause. Let us see that. Next one. Now comes the concept of Dhatvagni Mandya. Ama, which is basic, ama which is present in the body, that is the basic cause of all these problems. We know that rogaha sarvepi mandagno. So mandagni itself is the main cause for all the problems. Okay, so first there is formation of ama. This ama present in two forms. One form, it is present in the GAT level. Another form, this ama is present in the cellular level. One which is present in the GAT level is called as ama. One which is present in the cellular level, it is called as sama. Okay, so now Dhatvagni is related to the cellular metabolism. That is, Dhatvagni is related with the prevention of ama at the cellular level. Okay, when there is Dhatvagni Mandya due to certain issues, okay, that is Tesham Sada Atidiptibhyam Dhatu Vruddhi Kshayodbhava. When there is Dhatvagni Mandya, there is Vruddhi, that is Dhatu Vruddhi. This Dhatu Vruddhi is considered as abnormal form of Dhatu Vruddhi. It may be in the form of deposition, it may be in the form of collection, it may be in the form of over accumulation, anything. Okay, so there is collection of some abnormal ama in the tissue level or cellular level is there, and that is called as sama, and the main cause is Dhatvagni Mandya. Okay, now when ama is not get cleared for many time, so what happens? It gets converted into amavisha. It is converted into amavisha. We know that amavisha is a toxic, insoluble, water insoluble item. It is a material which is water insoluble. It is a toxic, and important is it is amavisha, therefore it has got an antigenic activity. Okay, it had got antigen like activity. So that is the important thing. It exerts an antigenic effect over the body. When an antigenic substance is continuously stimulating the body immune system, okay, continuously it is deposited in the body, it is acting as amavisha or antigenic, and it is continuously stimulating the body immune system. So what happens? It evokes an antigenic effect over the immune system, leading to different exaggerated immune responses. Immune system is get confused, or immune system is get abnormal or aberrated when there is a continuous antigenic stimulation within the body by the own body substances, that is ama. Okay, the ama is formed from the body only. That ama is get collected and exerting an antigenic effect to the immune system. Now immune system is quite confused, and it now start giving an exaggerated response, and this particular exaggerated response stimulates the body immune system, and such exaggerated immune response is a cause of glomerular damage, leading to pathology of minimal change nephrotic syndrome. Next. Okay, so we have concluded that this ama is the basic cause. This ama is deposited in the body, especially in the glomerular area, causing damage to the glomerular area, and there is an antigenic damage, and glomerular filtration rate is get disturbed and leading to all the pathologies. Now, what is the treatment? So, main treatment, the first line of treatment is always 𝐴𝐴-Pachana treatment. Okay. In case of nephrotic syndrome, when you are dealing with the child, this is the first line of treatment. We have to go for 𝐴𝐴-Pachana treatment. There is āma in the dhatu level. To clear this vigorous āma, a vigorous āma-Pachana treatment is required. So, common āma-Pachana drugs which we are using in our practice is either go for shunti, maricha or musta, etc. They are very good āma-Pachana. Other options are also there. Panchakola churnas, chitrakasava, chitrakadivati can be also used. Anyway, we have to ensure the āma-Pachana because that itself is the basic cause of this problem. That āma visha is causing the problem to the body immune system or leading to aberration of the bhojas. Now, some other options with us to deal with this problem is Arogyavardhan Rasa, that is also very good in Dhatu Agni Mandya. Then Agni Tundivati, Rajanyadi Churna, Ajamodadi Churna can be also used. Okay. Long term and continuous āma-Pachana chikitsa is must to prevent daily production of the āma, and for the clearance of already collected āma, daily we have to go for āma-Pachana treatment. Any other palatable, easily tolerable āma-Pachana drug can be also given as for our convenience. Preferably, a Deepana and Pachana drug is more beneficial. The drug which increase the digestion power and drug which increase the digestion. So, that is Deepana and Pachana drug. That is quite good, a best option. Okay. So, now daily intake of Ushna Jala is also act as a very good āma-Pachana. Intake of lagu substances in the food, mild langana also that means increase the āma-Pachana, and avoid certain undigestible protein in the diet, because some of the proteins which are undigestible may further increase the āma. Okay, because proteins are always having antigenic property. So, āma, if it is formed from the proteins, that is more dangerous in case of nephrotic syndrome. Therefore, we have to avoid some undigestible complicated proteins in the diet. Next. So, one thing is very clear. What is that? That is, we have to go for āma-Pachana treatment because there is involvement of ojas. That involvement of the ojas is because of Agni Mandya, Dhatu Agni Mandya. To clear that, we have to go for āma-Pachana treatment. Next is there is involvement of Medihovaha Srotas. See, Dhatu Agni Mandya is basically occurs at the Medo Dhatu level. Now, next question comes, where actually the Dhatu Agni Mandya exists? It is basically exists in the Medo Dhatu level involving the Medihovaha Srotas. There is clear-cut involvement of Medihovaha Srotas in case of nephrotic syndrome. Okay, because Mula of the Medihovaha Srotas is Vrikka and as well as Vapavana. Okay, so Vrikka in this case we will not consider only kidney. Kidney along with the adrenal glands should be considered as Vrikka, and that is the Mula of Medihovaha Srotas, and kidneys get affected in case of nephrotic syndrome. Okay, so nephrotic syndrome is there with the involvement of kidney, not with the urinary system. Urinary tracts are not much involved here. Okay, so they are not involved. Only nephrotic part, that is nephrons are getting involved, which is present in the kidney. So, that kidney is the Mula of what you say Medihovaha Srotas. So, there is also so many hormones which are produced from the kidney, especially adrenal glands, which play a very important role in the metabolism of the fat. Okay. So, therefore, there is disturbed fat metabolism in the form of hyperlipidemia, cholesteremia, etc. in nephrotic syndrome, which clearly suggests that there is involvement of Medihovaha Srotas. Okay, hypercholesteremia is a basic problem in case of what you say nephrotic syndrome. So, how it is possible? It is possible only because there is involvement of the Medihovaha Srotas, and Medihovaha Srota Mula is Vrikka, and Vrikka we consider both adrenal glands and as well as kidney, and these adrenal glands, they produce so many hormones which plays a vital role in the metabolism of the fat. When this is not happening, there is abnormal accumulation of the fat in the body and also production of more and more fat in the body, like in the form of lipoproteins. Next. So, we can also consider the concept of Medavrta Vata and Medogata Vata. Now, we comes to the treatment of Medihovaha Sroto Drishti. So, what should be the treatment? We have to go for treatment of Medihovaha Sroto Drishti. That is the second important culprit here. So, we have to go for Shroto Shodhana drugs. We have to go for Shroto Shodhana drugs. We know that Vrikka is formed by Kapha, Meda and Shonita. Okay. So, we have to take care of these three things. See, Kapha is already involved, Meda is involved and Shonita is also involved, because all these changes are happening in the Shonita itself, presented in the Shonita itself, and Vrikka is basically Kapha, Meda, Shonita, Prabhava. Okay. Therefore, drugs which stabilize these three organs should be always given. Okay. So what we go for? So Medihovaha Sroto Dushti, or for treatment of Medihovaha Srotas, Kshara preparations are always good. Okay. So we have tried Kshara Basti in so many patients, but it's not giving good result because of so many limitations. Anyhow, to correct the Medihovaha Srotas, along with the Pachana treatment, we have to go for Gugulu preparations. Gugulu is basically Medohara. So drugs which stabilize the Medo Dhatu like Navaka Gugulu, Kanchanara Gugulu, Shilajitu preparations, and so many other Gugulu preparations can be given along with the previous Pachana drugs. This is the second prescription to correct the Medihovaha Srotas. Next one. Third treatment is Oja Vyapath treatment. Now we have to look into Ojas also, because either there is aberration of the Ojas or there is Kshaya of the Ojas. So to modulate and educate the immune system, because we have to educate the immune system, that immune system should not give an exaggerated reaction. In this case, the immune system is given an exaggerated reaction. So control the exaggerated reaction, we have to go for Oja Vyapath treatment. Okay. Ojas aberration should be corrected. We have to teach, we have to modulate the immune system so that it should not give an exaggerated immune reaction. So Sattvika food should be offered. We have to correct the Ojas aberration, because Ojas is directly related with the Sattvika food. Okay, this is again clear in case of Rajayakshma, where he says Ojasoho vardito ashvibhyam shuddham sattvam atapicha. So when Ojas is increased, Sattvika bhava is also increased. So it is vice versa. When you give the Sattvika food also, the Ojas will going to increase. Then usually the relapse occur after a viral attack when the immune system is stimulated. See, this is frequently observed. When the relapse occur, when the patient has got upper respiratory tract infection because of any viral infection, the relapse of nephrotic syndrome occurs. Why? Because during viral infection, always there is an exaggerated immune response will be seen, and that is sufficient to cause the nephrotic syndrome again and again. Okay, because basically this is because of exaggerated immune reaction. So diet and drugs which are similar to the qualities of Ojas should be taken, especially Snigdha, Madhura, Prasada, Guru, Shita and Prasanna. So these are the qualities of Ojas, and drugs which are having these properties should be given. Then Vrishya drug should be administered because it increases the Ojas. Again, immunomodulated drugs like Guduchi, Punarnava, Pippali, Ashwagandha. So these are the drug of choice. So what I will do is, I will prefer is, you make a Kshirapaka of all the immunomodulated drugs, and on the daily basis, twice daily, give the Kshirapaka which is prepared out of these immunomodulated drugs as a fixed treatment for nephrotic syndrome. Next. Now, immunomodulation can be also done through the diet and as well as regimen. We can go for Shadrasa Yukta Ahara, Sattvika food like Shira and Grita, Nitya Kshira Grita Sevina, that is also Oja Vardhaka. Then avoid Ajirna, follow the rules of food intake. Avoid Paryushita Asatmya Ahara, then proper exercise. Follow the Sadvrita, Swasthavrita and faith therapy, and then yoga and pranayama. These are all the factors which controls the Ojas, which modulate the Ojas, which educate the immune system. Okay. In the meantime, it also increases the body immune capacity and does the function of a Oja Vardhana. Next. Now, one of the most important drug in case of treatment of what you say nephrotic syndrome is 𝐻𝑇 Madhu. 𝐻𝑇 Madhu is basically a Vrishya, Kantya, then Varnya and Kapha-chedaka, all properties are there. Basically, it is a Vayastapana drug also according to Charaka, and therefore I always prefer this 𝐻𝑇 Madhu Rasayana as one of the drug of choice to increase the body immune system. Okay, to educate the body immune system as an immunomodulator, 𝐻𝑇 Madhu plays a very important role. Different researchers also prove that 𝐻𝑇 Madhu biochemically has got molecular level, it has got some steroid-like activity, steroid rings are there. So anyway, in Ayurvedic treatment, 𝐻𝑇 Madhu plays a very vital role in the management of nephrotic syndrome, because we can give it in the form of 𝐻𝑇 Madhu Rasayana, can give in the form of 𝐻𝑇 Madhu Fanta or 𝐻𝑇 Madhu Kshira, etc. Next. One more important factor in nephrotic syndrome is involvement of Udakavaha Srotas, because we know that fluid pathologies, edema is there. So presence of edema is the main presenting symptom, so which is later becomes generalized. Initially it is around the eyeballs and the dependent most portion of the body, and later on it becomes generalized and spread all over the body. So improper distribution of the fluid in the different compartments of the body is the main cause, and this fluid distribution impairment is because of absence of the or low amount of albumin in the vascular system. Okay, albumin plays a vital role in maintaining the plasma oncotic pressure. When albumin is lost through the urine, then there is impairment of the fluid distribution. So bring back the So what is our aim? We have to bring back this fluid back into the vascular system. We have to bring back the fluid back into the vascular system, and this is possible only by one method. What is that? We have to increase the plasma protein level. We have to increase the albumin level by anyhow. Then only the fluid which is distributed outside the vascular membrane or vascular compartment will come back to the vascular compartment. So how it is done? Next. So how to maintain the plasma oncotic pressure? It is very simple. We have to increase the protein synthesis, especially albumin, and it is done by liver function, increasing the liver function. We have to increase the liver function. Okay. So liver function, when it is increased, then it leads to more and more production of the albumin, and this albumin now maintain the plasma oncotic pressure, and edema will be get reduced. That is 𝐍𝐴 Sroto Dushti will be get clear. So this is done by increasing the functions of the liver by Rohitaka, Bhumyamalaki and Amalaki. These are the drug of choice. Even Kumari is also good. Then this is one method by increasing the liver capacity. Then increase the plasma protein in the body by different methods. So one of the frequent methods we use is Tiradiapana Basti. So that is can be considered as protein supplementation through the Basti route. Okay, or Kukkutangatwak Basti. That is also one more method that can be tried. Or intake of some easily digestible protein, that can be also tried. In the context of Urakshata, Acharya explains about Chatakanda Rasa. That is Chatakanda Rasa. It is egg albumin, which increases the albumin level, because we know that egg albumin is rich in albumin. This albumin increases the protein level, and it helps to maintain the plasma oncotic pressure. Then 𝐍𝐴 Sroto's involvement can be corrected by maintaining the plasma albumin level. Very clear. So this is how to treat the 𝐍𝐴 Sroto Dushti. So first is Amapachana. Second one we have seen the Medho Sroto Dushti and correction. Third one we have seen the Vojovardhaka treatment, and fourth one we have now seen correction of the 𝐍𝐴 Sroto Dushti. Next one. Now there is role of Mutrala Aushadha as a diuretic. Okay, so when edema fluid is more, causing the compressive symptoms like effusion, etc., diuretics are suggested. Modern science, contemporary science explains about different types of chlorothiazides, Lasix, or even the spironolactone, which are potassium sparing diuretics, are explained. So there are different opinions on diuretics, whether to use or not. But anyway, as far as Ayurveda is concerned, Mutra formation and excretion is normal in this disease. In nephrotic syndrome, there is no problem with the formation of the Mutra. The problem is only that Mutra contains some more amount of useful substance like albumin, etc. And that problem is because of the glomerulus, not because of the filtration or formation of the urine. Okay. So except advanced stage of the disease, there is no involvement of Mutra formation itself. So problem is only with the glomerulus, not in the collecting tubules, etc. So anyhow, Mutrala drugs which are also renal protective should be used, because we have to go for Mutrala drugs to decrease the edema load also. Okay. So those drugs which are also Mutrala, which are also renal protective, should be preferred. Okay. So Punarnava, Gokshura, Sariva, Ushira and Shirajitu preparations and Haridra can be used to serve both the purpose. We want a renal protective function, we also want a diuretic function. Next one. One more important principle is, we know that recurrent respiratory tract infection always leads to exaggeration of the nephrotic syndrome. So we have to maintain the aseptic condition of the urinary tract. So UTI should be prevented by different methods. So usually we will prefer either Pratina Pranchamula Quath or Gokshuradi Gugul, Gokshuradi Quath, Chandraprabhavati or Shweta Prapati. Shweta Prapati maintains the pH of the urine. So by that it helps to prevent the urinary tract infection. This can be also used. Next. When patient comes to Ayurveda, now this is a main question. Patient will not come in the initial phase. Usually patient comes to Ayurveda in the later phase. Either this is accidentally diagnosed, patient is coming to Ayurveda for some other problem, that time this is accidentally diagnosed by urine test, or patient comes to us with some allergy and he is telling that some edema is there, and the patient is telling that maybe because of some allergy, therefore he is coming to Ayurveda. That edema is, he thinks that edema is because of allergy, but it may be because of nephrotic syndrome, so accidentally diagnosed. There is swelling around the eyeball in the morning hours, which later go on declining. With this complaint, patient comes to you. Patient took the treatment for nephrotic syndrome for so many months or many years, and then he is coming to you, or he is not interested to continue with the steroid or routine treatment, therefore he is coming to you. Or patient coming to you after he is fed up of recurrence, therefore or monotonic treatment, go on taking steroids and go on taking steroids, therefore he is coming to you. Then he is aware, sometimes some educated patients, they are aware of adverse effects of the steroids, therefore patient is coming to you, and some patients are coming to you with the trust in Ayurveda. So these are the different section of the patients which are coming to you. Sometimes they are coming to some other problem, accidental diagnosis and continue the treatment. Sometimes they are fed up of contemporary treatment, then they come to you. These are the different types of problems which is occurring. So what cases can be safely treated by Ayurveda? This is also very important. Which cases can be safely treated? Early detected cases can be safely treated, because selection of the patient is very important. We cannot treat all the patients. Early detected cases can be safely treated. On steroids since last 1 to 2 years, yes, we can take up that case. Then not developed much relapses, that is also a safe case for Ayurveda. Then not on other immunosuppressive drugs other than steroids, that is also a good case. Then secondary nephrotic syndrome is not there, that is also a good condition. Massive development of edema with the compromising symptoms are not seen. So these conditions, these are considered safe cases, and we can treat these cases in Ayurveda. Next, what are the limitations when you are going for Ayurvedic treatment? Cases of nephrotic syndrome which are in the end stage of the disorders, yes, we have to be careful. Cases which are not in a position to withdraw the steroids and due to the risk of relapse, there also you have to be a little bit careful. Then child less than 2 years, because of limitation of administration of the medicine, it is quite difficult. Chronic cases of steroid resistant nephrotic syndrome, that has to be also seen with careful eyes, because it may lead to the disturbance of renal function, or it may lead to secondary type of nephrotic syndrome, and cases with associated other pathology of the urinary tract, like structural problems or congenital problems, etc., or genetic problems, etc., that has to be seen carefully. Next, now Rasayana treatment is one more mode of treatment. Okay, so regeneration of the damaged tissue. There is some degeneration, some damage to the glomerulus and nephrons, and that has to be corrected. So we have to go for Rasayana treatment. Rasayana treatment which is specific to vruka and kidney and the Medihovaha Sroto should be given, and Nisha Amalaki Rasayana, this is the drug of choice as far as my treatment is concerned. Punarnava and Shilajit preparations, so they are the best Rasayana drugs aiming to the urinary, that is Medihovaha Sroto. Next, to prevent the recurrent respiratory tract infection, this is also a biggest problem, because every respiratory tract infection leads to further relapse of the case. Therefore, one of the most common cause of relapse is upper respiratory tract infection. So with each relapse, the disease become more and more chronic, and steroid resistance will be developing. So prevention of recurrent respiratory infection indirectly prevent the chronicity of the nephrotic syndrome. At least if you are able to control the patient, able to control the upper respiratory tract infection and make the patient upper respiratory tract infection free for 1 or 2 years, then naturally the chance of recurrence of the nephrotic syndrome is also get reduced. Okay, this is seen in practice. So one of the mainstay of treatment, this has to be pointed out. Next, now how to treat the steroid adverse effects? See, when patient comes to Ayurveda, he is not only coming with the nephrotic syndrome, he is also coming with the steroid toxicity. So we have to treat this steroid toxicity also. It should be considered as 𝐿𝑺𝑗𝑒 along with the abnormal 𝐉𝑨𝑒𝑔𝑡𝑢𝑣. So 𝐻𝑚 treatment should be given. Okay, and treatment of Atisthaulia should be adopted here. Guruncha-atarpanam, heavy and non-nourishing food substances should be given. Then improve the immunity by different methods. It may be by ahara, it may be by vihara or other activities, and achara, rasana, etc. So this has to be given. Now when patient comes to Ayurveda, so how to start with? See, this is how we follow. Patient comes to Ayurveda with a lot of steroids, diuretics, tonics, and lots of hope. So first introduce our medicines without stopping any of the medicines which is given from the other sciences. After 15 days, first you stop the diuretics. If diuretics is going on, stop the diuretics. Then after 15 days, reduce the dose of steroids gradually. Meantime, continue all the Ayurvedic medications. Slowly increase the immunity by our methods and stop the steroids by gradual tapering. Okay, so decrease the chance of upper respiratory tract infection. Protein supplementation should be continued by different methods. And if you are able to decrease the relapse in a year, previously patient has got 3 relapses in 1 year, now in 1 year, in 3 years he has got 1 relapse, then it should be considered as a credit. Okay, it's a big achievement. So we have reduced the relapse and recurrence in many conditions, which shows the improvement from 3 per year to 1 in 3 years. So this much we have achieved. Next, some patient may comes to you, there is no swelling but urine is positive for albumin. Okay, so urine, when they are going for urine examination, urine is showing positive albumin, but there is no swelling and otherwise patient is quite healthy. So this is usually seen with the Ayurvedic practice. Many patients will have this problem, and if normal, everything is normal, continue with the Ayurvedic treatment with sufficient protein supplementation and let the traces of protein get wasted in the urine. Meantime, you supplement it through the oral intake. That's the best option. Otherwise, in order to stop the albumin which is going on through the urine, if you go for steroid treatment, and that further worsens the problem. Instead of that, let the protein go in the urine and give some extra oral protein supplementation orally. That's the good idea. Okay, next one. So with this we have seen the treatment principles of nephrotic syndrome. Now in short, nutshell, if I say my prescription will be in minimal change nephrotic syndrome or idiopathic nephrotic syndrome, where immune exaggeration itself is the basic cause for all the other manifestations, my prescription will be as follows. Number 1, we have to go with the Pachana drug. Go for Panchakola, Agnitundi, Chitrakadi, Chitrakasa or Arogyavardhini, anything. You can change, but there should be Pachana effect and it should be long term, it should be continued. Then Oja Vyapath Hara Chikitsa should be done, that is in the form of Yashti Madhu Rasayana or Vardhamala Pipali Rasayana or Nagabala Rasayana. You can choose any one of this. Then Medo Hara and Mutra treatment. So this can be achieved by Chandra Prabhavati, Gokshuradi Gugulu or Punarnava Gugulu. Then Yakrit Uttejaka treatment. This can be done by Bhumi Amalaki, Kumari or Rohitaka, etc. Then one Rasayana treatment should be there. Usually Rasayana or Ojo Vardhaka treatment. So that can be combined together. Usually I prescribe by Kshirapaka method. Most common drugs which are used is Ashwagandha, Shatavari, Vidarigandha, Bala, Punarnava, Lashuna, Pippali, Yashti Madhu, etc. Then we have to correct the mineral deficiencies and gastric irritation, if gastric irritation may be there if the patient is taking steroids. So in that condition we have to go for Avipatrika Churna, Shankha Basma or Godanti Basma. This is for mineral deficiency and as well as to correct the gastric irritation. Then protein supplementation should be done, that is egg albumin or other dietary proteins. Then correction of the food habits, low salt intake, and psychological treatment, boosting of the confidence of the child, that is also very important, yoga and pranayama, and good eating habits. This is my prescription in case of minimal nephrotic syndrome, and I have seen a very good results in a long term. Next. So last, what is the take home message? Selection of the patient is very, very important. Then long term treatment is required. Prompt medication is required. Prevention of upper respiratory infection is a key point. Judicious use of steroids. Then frequent urine examination and blood investigations should be done, and check the renal function test frequently, and advise the patient to maintain the nephrotic chart. Nephrotic chart contains all the details of nephrotic syndrome, and advise the patient for good eating habits. This is a take home message, and if you follow this particular treatment schedule, definitely we can get success in treatment of nephrotic syndrome, minimal change nephrotic syndrome through Ayurveda. With this I conclude. Thank you very much.